A persistent presence understanding walking pneumonia. Walking pneumonia is a type of pneumonia but milder. It often doesn't require bed rest or hospitalization. People with walking pneumonia can continue their daily activities, hence the name. However, don't let the name mislead you. Walking pneumonia is still a serious respiratory infection that requires proper medical attention. It affects the lungs, causing inflammation in the tiny air sacs responsible for oxygen exchange. While it can be inconvenient and uncomfortable, walking pneumonia is usually not life-threatening. With appropriate treatment, most people recover fully within a week or two. A concerning trend: the rise of walking pneumonia in children. Recent reports from Canada and the United States show a concerning rise in walking pneumonia cases, especially among children. This trend has alarmed healthcare professionals and public health officials alike. Data from hospitals and clinics indicate a significant increase in pediatric admissions related to respiratory illnesses, with walking pneumonia being a major contributor. This surge is particularly noticeable in younger children, raising concerns about their developing immune systems. The reasons for this recent spike are not entirely clear, but researchers are exploring potential links to the COVID-19 pandemic and its impact on children's immunity. The usual suspects: causes and transmission. Walking pneumonia is primarily caused by a bacterium called Mycoplasma pneumoniae. This bacterium infects the respiratory tract, leading to inflammation and fluid buildup in the lungs. The infection spreads easily through respiratory droplets released when an infected person coughs or sneezes. This makes close contact, especially in crowded settings like schools and daycare centers, a significant risk factor. Besides Mycoplasma pneumonia, other bacteria and viruses can also cause walking pneumonia. Understanding the specific cause is crucial for determining the appropriate treatment approach. Vulnerability and risk. Who is most susceptible? While anyone can get walking pneumonia, some groups are more susceptible than others. Children, especially those under 5, are at higher risk due to their developing immune systems. People with weakened immune systems, such as those with chronic illnesses or undergoing chemotherapy, are also more vulnerable. Similarly, older adults, particularly those with pre-existing respiratory conditions, are at increased risk of developing complications. Certain lifestyle factors like smoking can also increase susceptibility to walking pneumonia. Smokers are more likely to experience severe symptoms and complications. Section 5. Recognizing the signs, symptoms and treatment. The symptoms of walking pneumonia are often mild and resemble those of a common cold. This can make it difficult to diagnose based on symptoms alone. Common symptoms include a persistent cough, fatigue, low-grade fever, headache, and shortness of breath. However, the severity and combination of symptoms can vary from person to person. Treatment typically involves antibiotics, especially if the cause is bacterial. Rest, hydration, and over-the-counter medications can help manage symptoms like fever and body aches. Section 6. The aftermath of a pandemic. Exploring the reasons for the surge. The recent surge in walking pneumonia cases, particularly in children, has prompted investigations into potential contributing factors. One prominent theory is the impact of the COVID-19 pandemic. Lockdowns and social distancing measures, while necessary to curb the spread of COVID-19, may have inadvertently reduced exposure to common respiratory viruses. This lack of exposure could have led to a decline in immunity, making children more susceptible to infections like walking pneumonia. Furthermore, the pandemic's strain on healthcare systems and potential disruptions in routine vaccination schedules might have played a role in the resurgence of respiratory infections. Section 7. When to worry. Serious symptoms and seeking medical attention. While usually mild, walking pneumonia can sometimes lead to complications, especially if left untreated. It's crucial to seek immediate medical attention if you or your child experience difficulty breathing or rapid breathing, chest pain, high fever over 102 degrees Fahrenheit, confusion or disorientation, or bluish discoloration of lips or nails. These symptoms could indicate a worsening infection or complications like pleurisy, which is inflammation of the lining around the lungs, or respiratory failure. Section 8. Staying ahead of the curve, prevention and protection. Preventing walking pneumonia involves a multi-pronged approach focusing on good hygiene practices and vaccination. Regular hand washing, especially after coughing or sneezing, is crucial. Covering your mouth and nose with a tissue or your elbow when coughing or sneezing can prevent the spread of respiratory droplets. Avoiding close contact with sick individuals and staying home when sick are also essential. Vaccinations, including the pneumococcal vaccine, can significantly reduce the risk of pneumonia caused by certain bacteria. Staying up to date with recommended vaccinations is crucial for both children and adults. As we conclude this video, we hope you found the information on walking pneumonia insightful and helpful. Understanding the symptoms, treatment, and prevention methods is crucial for keeping yourself and your loved ones safe. Remember, staying informed is the first step towards better health. Thank you for watching the video. Please like and subscribe to the channel for more informative content on health and wellness. Your support helps us continue to provide valuable information. Stay healthy and take care.